There are a few places on the surface of the body that can help us find things that are deeper in the body. Surface anatomy is the study of the external surface of the body. Palpation is feeling structures through the skin, and auscultation is listening to things using a stethoscope or even just putting your ear over a spot. If you know the right places, you can tell a lot about what's going on inside the body without ever really going inside the body. The TMJ, or temporal mandibular joint, is the only movable joint in the skull. If this is not well aligned, you can have problems with chewing and you can have significant headaches. The zygomatic arch is your cheekbone. This is frequently broken in blows to the face. The facial artery is just under the jawline here. It's very difficult to find at times, but it is one of the pulse points that can be used to check your heart rate. The philtrum is the little divot under your nose. The cervical lymph nodes are found under the angle of your jaw. Palpating these is important to determining if there is an infection in the head region. The carotid artery is in the neck. This is usually the artery that is checked if someone is reclining and you're trying to get a heart rate. The sternocleidomastoid muscle is a large muscle in your neck. It is attached to the sternum here in the front, the clavicle, and the mastoid process of the skull. This is the muscle that lets you move your head from side to side and forward. The xiphoid process is at the base of your sternum. The ribs come up and meet right here. You can easily palpate this area. The subclavian artery and vein can be found immediately behind the clavicle. If you go about a third of the way down the clavicle and really press hard behind the clavicle, you can actually feel the pulse in the subclavian artery. The sternal angle is where the manubrium meets the sternum. What is significant about this is notice that this is where the ascending aorta stops, the arch is, and the descending aorta is found. This is also where the trachea branches into the right and left bronchial tubes and where the pulmonary trunk branches to the right and left pulmonary arteries. Here is the xiphoid process from the side view. You can see how the diaphragm is attached here at the xiphoid process. The posterior median furrow is right down the center of your back. The scapula is that triangular bone you can feel here. The spine you can palpate right along there. Here is the medial border. Here is the inferior angle. The iliac crest is at the top of the ilium. It's right at the top of your hip bone. If you draw a line from iliac crest to iliac crest, you have drawn the supracristal line. This is right at L4. This is important if you're going to do a lumbar puncture because you want to go in either just above L4 or just below L4, depending on the age of your patient. Here you see the scapula again. Here is the trapezius muscle, that kite-shaped muscle on your back. And the latissimus dorsi is your big back muscle that wraps around you right here. What's important is right here in this area, the edge of the trapezius, the edge of the latissimus, and the edge of the scapula, is you have an area called the triangle of auscultation. At this point, there is basically only skin and a little bit of muscle between the outside and the lungs. If you want to hear breath sounds in the back, this is the best place to listen. Sometimes physicians have you sort of hunch over to open up the triangle of auscultation a little bit. The costal margin is right along the edge of your ribs. Costal margin on this side as well. So here would be your xiphoid process right here. The linea semilunaris is the edge of the rectus abdominis. It's going to be about halfway between the outside of your body and the midline of your body. Right here where the linea semilunaris crosses the costal margin is where the gallbladder is located. The pubic crest is that ridge of bone right here at the very bottom of your torso. The linea alba is your midline. It's going to go right through your umbilicus. The anterior superior iliac spine is that part of your hip bone that is most forward. You can palpate this on everyone no matter how heavy they are. McBurney's point is where your appendix is, and it's right there just near that anterior superior iliac spine. You can actually find McBurney's point if you put your hand on your waist, spread your thumb and fingers as far apart as you can get them. Your ring finger should land pretty much on McBurney's point. And of course, McBurney's point is only on the right side of your body because that's where your appendix is. The axilla is the armpit. The cubital fossa, sometimes called the antecubital fossa, is this anterior bend in your elbow. The brachial artery is the major artery in your upper arm. As it gets to the elbow, it branches into the radial artery going down the thumb side of your arm and the ulnar artery coming down the little finger side of your arm. You should have a pulse in both of these arteries. Typically, it is the radial artery we check for a pulse. On the venous side, we have superficial veins as well as deep veins. And here we're looking at the superficial veins. The cephalic vein comes down on the thumb side. The basilic vein comes down on the little finger side, and they're usually connected right here in the antecubital fossa by the median cubital vein. These are the veins that are used when they draw blood from your arm. The median cubital vein is usually the most stable and the preferred vein. Across the back of your hand is the dorsal venous network. This is also an area they will draw blood from. The anatomical snuff box can be located if you extend your thumb and point it posteriorly. There will be the tendons of your thumb extensor muscles that will form a depression right there at the base of your thumb. This used to be where people would put a little bit of snuff and snort it. This is if you were in very polite society in the 1700s. The significance of this point is if you can find this point, you can find the radial pulse. It'll be right there in the anatomical snuff box. The natal cleft is what we call butt crack, and the gluteal folds are those butt cheek folds. The popliteal fossa is behind the knee. The hamstrings are the three muscles that are here on the back of the thigh. The gastrocnemius is the big fat bellied muscle here in your calf. And the greater trochanter can be palpated right here at the top of your femur. The posterior iliac spine can be palpated right here. If you draw a line between these two, you will find the ventral gluteal site. This is where the gluteal medius is. This is a place where injections can be given. You can actually put your fingers and thumb across here, make that line with the edge of your hand, and as long as you're sticking above that line, you're in a muscle that it's a good place to put a shot. The adductor muscles are the group of muscles that make up your inner thigh muscles. The quadriceps femoris are the four muscles that make up your quadriceps group here on the front of your leg. You have the rectus femoris down the front, and then the vastus muscles all around the rectus. The vastus lateralis and the vastus medialis are here. The vastus intermedius is behind the rectus femoris, so you really can't have that palpated across the front of the leg. The lateral malleolus is that ankle bump on the outside, and the medial malleolus is the ankle bump on the inside. The dorsalis pedis artery comes across the top of your foot. It's another pulse point. And the posterior tibial artery is right there, sort of behind your medial malleolus. The femoral vein is a deep vein. It's going to leave the body and come and go deep in the leg. But you have a superficial vein that comes down the inside of your leg. This is the great saphenous vein. While this vein does help return blood to the heart and it helps drain blood from the lower body, it is a superficial vein. This vein may be harvested to provide vein material for cardiac bypass surgery. The dorsalis venous arch is that group of blood vessels across the top of the foot. The sartorius is this long muscle. This is what helps you sit tailor fashion. And your adductor longus is right here. If you draw a triangle, you have what's called the femoral triangle. You're using the edge of the adductor and you're using the edge of the sartorius. And this is where your leg bends as it attaches to your body. In the femoral triangle, you can find the femoral artery, the femoral vein, and the inguinal lymph nodes. There are three basic sites for intramuscular injection. When you do an intramuscular injection, you want to avoid nerves, you want to avoid major blood vessels, and you want to use a large fleshy muscle. The deltoid muscle in the arm is one site for an intramuscular injection. The gluteus medius is another site, and here you find that inferior iliac spine and the greater trochanter. You can see how that line will describe the gluteus medius. And the vastus lateralis, down the side of the leg, is a site that's primarily used in children. Many times in very small children, the deltoid and the gluteus medius are not large enough, but the vastus lateralis can be used for intramuscular injections. Your pulse points are all of the areas where you can feel the rebound of an artery. This is how you're going to monitor heart rate. So you've got the superficial temporal artery, the facial artery, the common carotid artery, the brachial artery, radial artery, femoral artery. You need to know someone pretty well to check this one. Behind the knee is the popliteal artery, that posterior tibial artery, and the dorsalis pedis across the top of the foot. The radial artery and the carotid artery are the most common sites used for checking pulse. You can also listen to bowel sounds. Now we divide the abdomen into 4 quadrants: the right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. You want to listen in each of the 4 quadrants. Typically you hear gurgles every 5 to 15 seconds if everything is going like it should. If there are decreased bowel sounds, you don't hear bowel sounds at all, or it's much longer between bowel sounds, this can indicate that there's some sort of obstruction. And if there are increased bowel sounds, this means you have increased peristalsis. This usually means diarrhea or something like that is going on with your patient.